Hi, I'm Marty Drell, is what people mostly call me. And the idea of legacy is very important to an old man. And you think about it uh, as you're getting on in age more than I did when I was younger. I've been at LSU for about 35 years. I trained in Boston uh, a long time ago. And uh, During the peak of psychotherapy, uh, during my child residency, I gave one medication to one child during my 2 years. And my supervisors got angry at me and said that I was being influenced by my chief resident, who was more biological at the time and came from Mass General. And That patient was a depressed 17-year-old. And so I've had to learn psychopharm on my own. I've had to learn lots of things on my own because the field, the culture, and what child psychiatrists do has changed. So I got very good training for the time at Boston Children's Judge Baker. I got community training at Cambridge Hospital, which is a public hospital that's really in the public sector. So I got very good community training that I don't think I realized at the time how good it was. And probably the most important thing I did was to fall in love with the biopsychosocial model of George Engel, which made it so that I couldn't just be a psychotherapist. I had to learn the biology. I had to learn the social thing that I always thought was part of being a psychiatrist. And to that, I've added being systemic, which is looking at the larger picture and always asking the question, and then what, and then what, and then what. And I think people who are systemic are just a different way of thinking than people who aren't systemic. And then I would also say developmental. So when I say I'm a systems oriented, developmentally informed biopsychosocial person, I never say that I'm going to ever be good at all that. I'm better at some of the things, but I pay attention to when I am getting too into one thing versus another thing. I somehow always wanted to be a training director. I have no idea where that came from, but I always wanted to be a training director. So if you ask me, when I went to Baylor, so I went straight from Boston to Baylor in Houston. And they said, "What do you want to do, Marty?" And I said, "I want to be a training director." They said, "Well, you need your board exams and stuff like that," which I got. And then I was a training director. And then the head of child psychiatry at the time retired, uh, you know, and Dr. Hansen, as in the Hansen mid-year review course. Doug
Okay.
Hansen, that's a sort of link, to the past in the academy. And it's a several day course that goes over the field. And he went on it, and I made the mistake of accepting being acting head of the child division, and noticed that it was an interesting thing to do, involves some power, and a very interesting thing happened. All my friends, the training director friends, I had a cohort, and all of them, many of them just started treating me different. And then I had new sets of friends that wanted something, that they hadn't gotten. And so then I was the acting head, and conflict of interest. And then I went back to being training director again. All my old friends came back, and the other ones attached themselves to the new person. And I always remembered that. But I had a taste for being ahead of something. Again, And that led me to come to LSU, where I restarted the child psychiatry division, was their training director, did all the wonderfully horrible but interesting stuff of starting a child division, recruiting, et cetera, et cetera. And I've been here, and now I'm part-time, and am returning in my part-time. I'm now struggling with, what retirement will be for me. And the problem is I'm a workaholic, and in the sense that I have to be doing things all the time. I get sluggish. And so right now I've gotten rid of things that I didn't like to do. And I'm back to being a consultant, a mentor, and have a small psychotherapy practice that I can do the way I want to do it, like in the old days, and happened along the way uh, to do things. And I was a training director, so went to the training directors. And I went there, and I had one person I knew, Jim Lomax, who was the training director of the general program. And it turns out when you're in the training directors, if you're in the leadership, you're gone all the time. So I never saw Jim Lomax the whole time. And I said, oh my God, I need to do stuff. And so I volunteered for things, and started off with the Child Caucus. I had a good friend in Gene Barasson, and we both trained in Boston. And so we became good friends, did things together. And I sort of rose in the ranks in the training directors. Along the way, I was ahead when I got to LSU. I was ahead. So there's a special organization now called ADCAP that takes care of the training directors. So I was an organizational man, and I would do things. And the idea of somebody who actually has an idea and says yes and actually gets it done, regardless how well, is a pretty rare thing. And if you find there's a sucker that will do things, they'll ask you to do more things. And then fluky things happened, and I ended up being, I was run in the heads of child psychiatry as the person who was supposed to lose. There's always the nominee, there's the one that's going to win, and the one that's not going to win. I was the one that was not going to win, but I won. And so I found myself as a president way too early. And I did a good job, but I didn't do a great job. And so I really said I needed to be more proactive and not just make sure that the meeting ran okay and stuff like that, and that the trains ran on time. And once you become a president of something or do anything, well, you keep on getting asked. So never run and be editor of a newsletter unless you don't want to be a newsletter. So I've done 5 newsletters in my day. When they say, "Oh, Marty did it," was editor of this, boom, all of a sudden you're editor, and I enjoy that. I like writing, I like editing, but it takes up a lot of time. So once you're president, you get on a short list. So there's already a short list, I said, of the people who actually do what they say they're going to do. And really, that's a short list because life incurs and people get sick, and they get other jobs, and et cetera, et cetera. Luckily, I had a sense of humor, which helps a lot. And then I become president of things. But I became president of the academy, having been the president of another organization, and learned a lot from doing that. I was the head of child psychiatry, with all that meant, and it's a very interesting, complex thing. And somebody was just talking to me about you have to be insane to be president. And yeah, that's a little bit true. Very difficult. I can't figure out actually how I did it because I was head of my child division, but somehow it got done. And yes. As a teenager, I loved foreign cinema. I loved Federico Fellini. I loved the Italians. I loved the neorealism. I loved the French New Wave, Truffaut, Godard, and Ingmar Bergman. So I spent most of my time doing that. And during, I think, the 70s, there was some very funny Sophia Loren movies. And one of them was Yesterday, Today, and Tomorrow. So Sophia Loren was the inspiration for my presidential initiative. And it was to pay attention to the past, the present, and the here and now mindfulness, and the future. So for the past, I set about to do a history of the organization. And for the present, I noticed that some of the committees didn't have any staff. And then they had the more popular committees. And so I looked at how the organization was run and really, with the staff, revamped the support for the committees. I did a better job orienting them, mentoring them. We have meetings to say how it went. We identified committees that were doing well, and they were all staffed. And so if you wanted to do something, and you had brought up, you must have had a good staff. I was promised when I came to LSU, I'd always have a secretary. And now nobody has a secretary. And I just think it's really stupid. So you have myself, I was helicoptered by my secretary who knew how to do everything. And then all of a sudden, as I'm not had any more, my secretary disappears. So I don't know how to do typing the way I need to do. I don't know how to format a letter. And, I never could figure out, for lack of, a secretary, I'm not as efficient as I could be. So I could type things, but my secretary typed 95 words a minute. And so I think the idea of supporting people and supporting the committees and supporting the staff. And the reality is that the younger generation grew up with computers, and I'm a digital ignorant. And so I have troubles, and I'm not as effective as I could be, but I have lots of piles and I have my way of doing things. And people think it's sort of funny, but that's the way it goes. The things get done. My biggest presidential initiative. When I entered the field in the 70s, they did Project Future, and Project Future was startling. They basically said, rather than doing therapy on the working worried, why don't we focus and be doctors? Why don't we be doctors? And like every other, do the hard patients, the complex patients. And why don't we do more research? And why don't we do that? At the time, using my sense of humor, I said, this is very fascinating because it's basically saying everything I do and love, I'm not supposed to do, and I'm supposed to do all these things that I was not trained to do and stuff like that. And so I said, why don't we bring it back? Because things seem to be changing, and this was at the beginning of I think the medical industrial complex taking over, which is what's now all of us are dealing with, and medical schools don't have the power they do because they're owned by corporations and they get their money from corporations. And my attempt was to have lots of people. James McIntyre was the head of that. And I think we really identified what direction our field was going in. I think in some ways it's been faster than we think. I don't think we thought about AI because that was 15 years ago.
Right.
But I think we did that. And again, the challenge is coming up with what the problem is not as simple as, or is not as hard as figuring out what to do. And I think in some ways we're in the midst of large changes in our society and culture that's affecting not only the kids, but us. I said that we should all be interested in being systemic,
Hmm.
which means the community, which
Hmm.
means the village. And so I think the issue is that needs to be paid attention to. Development is sort of lost now. It's not as well taught. It's absolutely, I think, imperative that we talk about development. But in reality, when you have to do things fast and you have a 1 hour evaluation and you have RVUs and you're told what to do, it's hard to do a comprehensive evaluation. And in reality, to get paid, you just need a diagnosis. I think it's my job to talk about the ideal. And again, it's an aspirational goal to be systemic, developmental, biopsychosocial. I don't think anybody's going to reach it, but it's what you need to do. And you need to check that you aren't leaving out major parts totally. So Steve Sharfstein, who was the APA president, said in his keynote speech, I think we've turned into the bio rather than the biopsychosocial. In some ways, one of the dilemmas I have is I don't think the things that the world's having troubles with the underserved and the world on fire, is going to be cured by a pill. Would it be? To do that and to diagnose the world as being on fire, I don't think explains it. So I've been a big champion of uh, slowing down therapy and also pay attention to public sector work and larger scale theories, but also don't throw out the individual patient and being with the individual patient, which is what I adore doing. And so my dilemma is how are we going to deal with the gigantic psychosocial problems that are imperative in DEI and stuff like that when we are not doing the psychosocial training we need to do. So I said, this is what I think your aspirational goal is. I think you'll need to focus it for what your job is and what you need to do. But you should always be looking and being sure what you're not doing. And then we carry on, when I supervise, I try to say biopsychosocial, stuff like that.
Hmm.
And in medicine,
Yes.
the nature of the world is people say, "Oh, Marty, you do therapy. You don't give pills, do you?" I give pills all the time, you know. But you get put in these silos, and they know what you're doing because you do this. No, I like therapy. I write about therapy, and I write about
Hmm.
pills too if people read my articles. But that's the way. So I think it's important the real and the ideal. What I usually say is always go into meetings with the real and ideal. And my joke is that when you go to a meeting, there's half of the people are ideal people, half are real people. And when the ideal people talk, they irritate the real people. And when the real people talk, they irritate the ideal people. And then all of a sudden you have a fist fight where you really need the middle way of putting together what you can do the best you can with the resources you have and your abilities. And that's a real fascinating thing that I think is really good for people that have to run child divisions and things like that in the real world. And then the issue is there's some wonderful books, David Mintz, I think there's a new book by Shashank and Andres Martin on the meaning of psychopharmacology, in which they blend together the psychodynamic and the medication. And I think that's an aspirational goal of what can you get done in 20 minutes. It's
Yeah.
psychotherapy and family and work with the families. All those things are very important for medications. And David Mintz talks about if you're with a patient and you look at your computer during the session rather than be with them, the no-show rate goes down 20%. Fascinating. If you walk into a room in an inpatient and you stand and talk to the patient versus sit down, they ask the patients after, if you sit down, they think you've been there 3 times as long as you had. So there's all these wonderful research about how to be effective as a caregiver, and take care of people in ways that are there. And I'm listening to Bessel van der Kolk, The Body Keeps the Score. And he basically gets me back to my infant psychiatry days. And it's all about attachments and safe attachments and trust. When I say, I don't mind doing anything as long as I can hold somebody's hand while I'm going in, so it's better to go. If you want to go far, go with others. You want to, get something done. It's not the same. So I do believe in the village, but not that villages are very complex. And rather than system, I have no problem that, the mother is a village, the family is a village, the extended family is a village, your institutions are villages, but that's all George Engel and is, biosocial. And so the language has been updated and more trendy, but it's really just George Engel's biopsychosocial. My best advice was by Julie Richmond, who was the head of child psychiatry at Boston Children's. And he wasn't even a child psychiatrist. He was a pediatrician that helped start Head Start, and he was a psychoanalyst. And there was about 5 major pediatric psychoanalysts that were very prominent in getting things done. And he went to medical school with my uncle, at the University of Illinois. And he was a great man. He was the head of Health and Human Services and started Head Start. And he basically said, Marty, follow your bliss and the money will come. So my sense would be, you have a notion of what you want to do, but then life may not give it to you. But in some ways, follow your curiosity, follow your bliss. And my bliss was I liked young kids. I like children. As I said, all the problems in the world are not due to the children. It's due to the adults. So I like the adults. When I go into a room, I look for the kids because they make me smile. And so I was interested in infants and hadn't been trained by infants in infant psychiatry. So I got interested in that. I followed my bliss. As a training director, there was almost no didactics. In my program, there was like one didactic. Julie Richmond, who said, follow your bliss, said, we don't really believe in reading that much. We want to give you cases galore and supervisors. So I had 5 hours of supervision every week and about lots of patients. And my supervisors would say, oh, there's a really good paper. And they'd give me a paper. And in some ways, that worked really well. I read the papers and you got to read the papers. And Julie Richmond also said, you know, everybody forgets about one of the best supervisors ever. And we'd say, what? What? And he said, reading, reading and learning. So I think I would add to my aspirationals, be a lifelong learner and just follow your nose. So right now, infant psychiatry, but all the trauma work, all the attachment work, I all knew that in the 90s because I was doing infant psychiatry, and the idea has sort of generalized to what we do. And now everything's trauma. Now everything's attachment. And, you know, I'll say, you have a anxious attachment. You know, and they said, well, what do you mean by that? And then I explain them and I educate. And I've always, whatever I'm doing, I write about. I write columns and stuff like that. So follow your bliss and find what you like to do and then do it. If you like forensics, do forensics. If you like, substance abuse, and gosh knows, there's so much substance abuse and stuff like that. To me, it's all acting out. It's all, I have a pain. How am I going to soothe the pain? Am I going to soothe it with pills? Am I going to soothe it with drugs, alcohol, hypersexuality, et cetera, et cetera? But to me, I'm sticking with my model of it's hard to be in the world, and it's painful, and life involves suffering, and find a model that works for you. Engels biopsychosocial, psychodynamic, cognitive behavioral therapy, family therapy is just enlightening, and how few people get trained in that. What is amazing about that, which is systemic. So the family therapy helped me be systemic even more, and everything's attached to everybody else, and everything's complicated. You know, my goal is to make things complicated and not simple. Yeah, I'm sticking with it. I've always had mentors. I've written about mentorship. It's not an easy thing. My paper is Mentor or Tormentor, and that I do a mentor program to help people learn psychodynamic and how to train it. And we have about 6 per year, and it's by the Leatherman Drell Ritfo Fund of the American Academy. Out of the 6 mentorships, we try to pick it right with what the interests are, and about 1 in 6 just don't. It's not a love connection, and it's hard. But I think I've always had mentors. I don't think I ever thought about them, but like Norm Enzer, a wonderful man, died a couple years ago, and was a fixture in the academy. Wonderful man, was at LSU, and I think he took care of me because I was at LSU. He was at Michigan State at the time, and I went to my first meeting of the ADCAP, the heads of child psychiatry. And during the break, he says, Marty, I want you to be program director of the program for the annual meeting the next year. And I said, Norm, this is my first meeting. Why would you do that? And he said, just do it. Okay. Then the next year, it's a 2-year run, so he had me do that too. And I wrote with Peter Jensen, who was brand new, a grant to get some money for bringing in people, and we did a program on how to support research. And that was the old days, speaking of support. Peter Jensen was brand new. That's the first time I ever used a fax. That was before text, that was before iPhones. And we were, how do you do a text? How do you do, a fax? But we got it done. And that was sort of streamlined me. And that was when you get to do prominent things in your first year, people say, "Whoa, he must know what he's doing," or Norm must know what he's doing. And so there's always been people, I think, uh, got me to do things, or at least another lesson I learned is imposter syndrome. Everybody has imposter syndrome. And, I found out over the years that if people think I can do them, I probably can do them. Because I'm not the best observer of myself. If Ginger Anthony says I should do something, probably I should listen and do it. And it usually works out fairly well. About the wellness, I actually think that needs to be complicated too, because the reality, and I'm doing a section in the Owls newsletter for the older members, and we have 3 articles on retirement. And one is we did a survey, Alan Zemetkin did it, and we're trying to figure out what things that child psychiatrists can do when facing retirement. He just sent me, so he's a new mentor, and he just sent me an article from the Washington Post that basically said the people who actually work older have better mental and physical health. They live longer. But that is if you like what you're doing. So if you like what you're doing and get a kick out of doing that, are you a workaholic, or are you just somebody on a mission, to do stuff, which is really good for you? So I'm trying to figure out the right balance. And one of my favorite statements is, as you get older, it's harder and harder to do the things you never wanted to do in the first place. There's things you just do, like you're a father. There's things you do because you're a father, and when you're head, you do some things. When you're training director, you got to do some things. You get to set the standard. And, so I still enjoy the things I'm doing, which are the psychotherapy, the mentoring, working in national organizations to get things done. And that enriches me. And I can't figure out what else I would do. I have plenty of hobbies, but I'm working. Pay attention to the bio, psycho, and social. Find your balance. Find your bliss, and it's a balance. And I have a metaphor that I use that people like. It's everybody's trying to put 10 pounds of poop in a 5-pound bag, and there's just too much to do. And people are anxious, and they feel that they're not doing a good job, and they feel like they're failing, and they are helicoptering. And I think we can, do a lot to help parents have a better balance between, their life and their work, and to do that. And that's a very difficult thing in this fast-paced world in which everybody's on their phones and stuff like that. And I was an English major, really editing and writing. I still write columns that are in the AdCap newsletter, which I edit. So also with the Owls newsletter, they're really different focuses. The Owls newsletter is sort of my attempt to do AARP for the older psychiatrists. So we're talking about retirement and different things for the heads of child psychiatry. It's more how to be a child psychiatrist, work on problems. I do mentorship. We do Zoom meetings. I have for the last 15 years, mentor program at the beginning of all the AdCap at the AdCap meetings for new heads of child psychiatry. And we have expanded that to Zoom calls. And, so there's a theme of I'm still teaching. I'm still curious, and that keeps me going. And I'm still pretty much, if you ask me to do something and it's not onerous or too much poop, I'll help you out with it. And so, I get asked to do things and for the meetings, and I do my presenting still, and I'm on the psychotherapy committee, and spend a week every week with Rachel Ridfo and Mike Shapiro to try to figure out how to keep psychotherapy, especially psychodynamic, in the curriculum. And that's a real
Yes.
challenge. And we're all trying to figure out ways to do that because we really think it's important. This was 1980s, I think. And they had a very good program that existed. And it was like a weekend program. And one of the questions they asked were, describe your cultural food, you know? So what's the white culture's food? Bunny bread, white bread? And so I realized at that point that my culture I was Jewish, you know? And so I thought of all the Jewish things that was eating, and that was, I'd just been to LSU. So now I have all my great culture of Cajun Creole food and wonderful food. But at that point, they said, tell me, and reality, and they just said, white people are in charge. They don't need to worry about their own ethics. Whatever they want is what they do. And I thought, ooh, 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 you know, and that, they introduced me that I define myself by Jewish food and my family history. And that really was at the time puzzling, infuriating, but very interesting. And I've always read about it, and it's been, there's much more about it now. I think I understand it. There's a part of me that the biopsychosocial, I have always thought that culture was in the social part. So I've always yearned to know that. And the other problem I have is, as a psychotherapist, as a psychodynamic therapist, I do one person at a time. And that part of me is learning about their culture, what their problems are, and what their problems are. So I thought psychodynamic therapy, if done correctly in the system, developmental biopsychosocial, always, I think you needed to do that. Whether you did it in a good way or whether you have implicit bias, which are countertransferences to us. And I certainly put it on the conscious. And I think one of the dilemmas of our time is, how do you deal with implicit biases? How do you deal with things that people aren't aware of? So, which links, now that I think about it, to how do you deal with trauma that occurs before you're verbal? So,
Right.
so again, that links together. And how do you get people who are angry at each other to sit down and talk to each other? As a psychodynamic person, I get to know people better than their spouses know them. That's an honor. And it's humbling. And I've had years of therapy, so I know a little bit about my own biases,
Mhm.
implicit biases, and yet it's very difficult to know. So the diversity training started early. I didn't necessarily quite get it. And I had a lot of things that covered me for, oh, I'm doing that anyway. But I think in some ways you can learn as you go along. I had a, a wonderful feminist significant other for a time, and uh, she really educated me about uh, gender issues and
Yeah.
feminism, and that
Mhm.
the world, if it's there, teaches you a lot of things if you want to be taught.
Right. And it sounds like you were saying, it sounds like you were describing that when you went to that training,
Yeah.
it helped you recognize more about your own culture. People were assuming one thing about you, and you were able to say, no, that's not really my culture. I'm Jewish. This is where my thinking comes from.
Yeah,
And so
and that
yourself.
it was a shock
Mhm.
to the system, which is sometimes good, sometimes bad. It was irritating and stressful, but I've always been somebody who actually gets defensive, but then say, I wonder if they're right, and I may not tell them that they're ever right. I've done a lot of, and put it in, I've done a lot of articles. Tammy Benton was president of the AdCap. So in honor
Mhm.
of her as editor, I wrote up probably 20, 25 book reviews uh, on racial issues and lots of biographical about major figures that a lot of people haven't really thought about. And Sojourner Truth and a lot of the other people, and a lot of people around about the Ku Klux Klan I wrote about, and I wrote about Marcus Garvey, and it's been really fascinating. One of my hobbies is history,
Mhm.
which is, again, I'm very sad that there isn't more interest in the history because it really does inform you about things.